Hey there, today we're covering how to build a healthcare price comparison engine with mobile proxies. What bacato portive at top of fakeni? Patients struggle to compare prices for medical procedures, consultations, and treatments across providers. In Southeast Asia, where healthcare systems range from Singapore's world-class private hospitals to Indonesia's rapidly expanding public health infrastructure, price transparency is even more challenging. Building a healthcare price comparison engine addresses this gap by collecting, normalizing, and presenting medical pricing data from hospitals, clinics, and healthcare platforms across the region. The technical backbone of such a system is reliable proxy infrastructure that enables continuous data collection from diverse healthcare provider websites. Healthcare pricing in Southeast Asia is complex for several reasons. Some providers quote all-inclusive package prices, while others list each component separately. Costs depend on patient conditions, insurance coverage, and negotiated rates. Many providers do not publish pricing online or publish only starting prices. Cross-border comparison requires currency normalization, and price alone does not reflect the quality of care or included services. Pricing within a single country can also vary dramatically between cities. What the chapters? Medical tourism is a major driver, as Southeast Asia attracts millions of medical tourists who need to compare costs across countries. Insurance companies need pricing data to set reimbursement rates and identify cost-effective providers. Employers with regional operations need to benchmark healthcare costs for employee benefits. Local patients increasingly research costs before choosing providers, and hospitals and clinics themselves need competitive pricing intelligence. Most major hospitals in Southeast Asia now publish at least some pricing information online, including package prices for common procedures like health screenings, dental, and cosmetic work, consultation fees by department or specialist level, room rates and hospitalization costs, and health screening packages with tiered pricing. Online healthcare booking platforms aggregate provider information. Doctor Anywhere, HaloDoc, and similar platforms list consultation fees. Medical tourism platforms like Medical Departures and Dental Departures publish procedure prices, and health screening aggregators compare package prices. Several SEE governments have launched healthcare pricing transparency efforts. Singapore's Ministry of Health publishes bill size data by procedure. Thailand's Medical Tourism Board publishes indicative pricing. Indonesia's BPJS Kesehatan, the national insurance program, publishes covered procedure rates. Malaysia's Ministry of Health publishes fee schedule guidelines. Insurance and benefits data sources include published insurance plan networks and fee schedules, corporate healthcare benefits information, and government insurance coverage rates. The system architecture has three main components. The data collection engine runs a multi-threaded crawler using data research tools, mobile proxies, with source-specific parsers for each hospital and platform, a scheduling system for regular price updates, and error handling and retry logic. The processing pipeline handles price extraction and normalization, procedure categorization using standard medical coding, currency conversion, and data quality validation. The comparison engine provides search and filter capabilities, cross-provider and cross-country comparison with currency normalization, and trend analysis using historical pricing data. The database schema ties all of this together, storing providers, procedures, prices, and historical records in a structured format. Each hospital website has a unique structure requiring custom parsers, so the collection layer is built with source-specific logic for each major provider. Medical tourism platforms are scraped similarly to capture procedure prices published by aggregators like Medical Departures and Dental Departures. Healthcare prices come in many formats, so they need to be normalized before meaningful comparison is possible. This means stripping currency symbols, converting ranges to midpoints, and standardizing to a common currency. How's the normalized? The comparison engine can generate cross-provider and cross-country views. What the type of view types meet different update frequencies. Consultation fees and screening packages may be checked weekly, while room rates and procedure packages may be updated monthly. When significant price changes occur, the system alerts relevant stakeholders so they can act on the new information. What bacato portive at top of fact can you? Masig topring securities text vases talk to basil, show me thimitan stakeholder, show me to my program, ket a bottom recipe. For type of show fancy third, you take and fancy. Use country-specific mobile proxies as data research tools. Mobile proxies ensure you see authentic local pricing for each SEA market. Always note what is included in a price, because a lower price that excludes anesthesia, room charges, or follow-up visits is not truly cheaper, and capturing inclusion and exclusion details matters. Clearly label whether a price is a fixed package, a starting estimate, or a negotiable range. Validate outliers. This means extremely low or high prices may indicate parsing errors, and automated validation helps catch these. Present data responsibly and note the limitations of collected pricing information. Since healthcare pricing is sensitive, use current exchange rates for cross-currency comparisons. And note the rates used. A healthcare price comparison engine powered by data research tools, Mobile Proxies fills a critical gap in healthcare transparency across Southeast Asia. By collecting pricing data from hospitals, clinics, and booking platforms across the region, normalizing it for meaningful comparison, and presenting it in an accessible format, you create value for patients, insurers, employers, and healthcare providers alike. Data research tools provides the proxy infrastructure essential for this type of cross-market data collection, with mobile proxy endpoints in every major SEE country, ensuring authentic, reliable access to healthcare pricing data. Without wide adult primers, with wide data. What's up, effective? Look into how AI and proxies are transforming drug discovery data pipelines. The best proxies for healthcare data collection in 2026. How anti-bot systems like Cloudflare, Akamai, and Perimeter X detect scrapers, when to use API access versus web scraping, and when proxies are needed, ASEAN data protection laws and web scraping compliance, and the best proxies for government data scraping. For more guides like this one, visit us at dataresearchtools.com. See you in the next one.